give you 2 minutes here. So let's get 2 minutes on the clock and your time starts now. All right, time is up, and let's have a look at what some of those answers could be. So, of course, don't we all love the red eye? Isn't it our most favourite presentation in the whole world? Okay, let's have a think. Has he noticed any visual deterioration or blurred vision? So looking at that visual acuity, and you could rephrase that as well to visual acuity there. I'd be using visual acuity, visual deterioration, or blurred vision. I don't think you'd be able to cross those over. I think if you put those on multiple lines, you're probably going to get only marks for your first response there. But certainly visual acuity is one of the most important things to be assessing for any red eye presentation, so you'll be getting those extra 2 marks there. Now, of course, it's not specified here, so you'd be wanting to know, is there any preceding trauma? Is there anything that's gone into the eye, any activity that may have precipitated? Try and find out what are those preceding events there, getting a mark. Now, of course, this could also be related to recent infection. So we'd be looking at any preceding illness or upper respiratory tract infection. Again, I think if you're specifying one or the other, and for that specificity, I probably would specify upper respiratory tract infection just to really hone in on one particular thing that I know is going to provoke this kind of presentation. Now, they have specified in here that there is no significant medical history. Now, that really refers to more kind of chronic or bigger conditions and may not necessarily state, oh, yes, he had a cough or cold 2 weeks ago or a week ago, and so it definitely is worthwhile still asking those follow-up questions. Now, again, another specific question here is, has he experienced photophobia? So some might argue there's a bit of overlap here between visual deterioration, visual acuity change. Really, photophobia is a very specific thing that is really kind of pointing in other directions, so I think would definitely get you an additional mark. Now, again, not specified here, but is there any history of contact lens use? Certainly, having those there as foreign bodies and potential infection sources is going to dramatically change the way you would approach this case, and certainly worth checking into. And of course, if we're then broadening out things a little bit, has he experienced any associated headache? Looking for some of those other kind of features that may cause unilateral red eye. Things like migraine, for example, or perhaps other sinister cases. Of course, these are the common things here, but we have more questions on the way. So let's get another 2 minutes on the clock, and your time starts now. All right, time is up, and again, let's have a look at what these answers could be. So we've already covered those history questions. Let's move on to some of the examination questions. And you will see this time and time again where it moves from one aspect to the other, but don't always count on this being the case. Now, of course, for examination, again, let's have a look at that qualifier there. It's asked for the most important diagnoses. So for that, we're going to be thinking our more kind of more extreme, more severe, the big red ticket items that we don't want to miss. So for that, what are those things going to be? Severe infections, intracranial kind of events. We want to be, again, looking for that pain on ocular movements. So, again, that's going to be hinting towards further pressure in the eye and, again, pointing towards sinister things. I won't ruin the surprise too much yet. Of course, now, photophobia. This is one of those tricky ones because we did specify that in history, and I would say you're probably being a little bit risky by including it in either or, but it is still a finding on examination as well, and some could make that argument there. Personally, I probably would stick it to history as someone's more likely to say, yes, I've experienced photophobia, as opposed to you shining a light in their eye and they say, ow. Hopefully that makes sense, but certainly you could try and argue either way there. Now again, that decreased visual acuity, we have specified that again. Now this would be still a specific examination finding because in the history they may not have noticed any visual acuity changes. However, when you pull out that Snellen chart or actually check and measure numerically or with some kind of appropriate scale what their vision is actually doing, that's when you're going to get the marks here. Now, of course, slit lamp examination, or realistically, what we're more likely to have access to in general practice will be fundoscopy. And in particular, here we'd be looking for cells in the anterior chamber. This is pointing more towards that kind of uveitis type picture. In particular, looking at that family history as well. I'm looking at eusarcoidosis and seeing could this be a uveitis picture. And of course, one thing we wouldn't want to miss, pointing towards more kind of glaucoma type processes, again being most important, is there any clouding of the cornea? All right. Hopefully that makes sense. Of course, we've got the final question for this case, 3 questions per case. Let's get 2 minutes on the clock and your time starts now. All right, time is up, and of course, let's get to the answers here. So they have provided additional information here in that he recovers from this episode, but returns 6 months later, stating he's had 2 further episodes since then of uveitis. Now, this is one of those times, again, they will give you that diagnosis, and you can sometimes use this additional information to actually look back at those previous questions and say, oh, actually, knowing that now, does that change, or should I be adding in other things there? What do I know about that could potentially score me marks in the last question? Of course, for this though, we are now going to be a bit more concerned. This is going to raise some serious red flags, or at least I hope it's raising some serious red flags for you, because recurrent uveitis, you need to be thinking, what are these potential rheumatological causes? And we have that strong family history there of sarcoidosis. Could this actually be a presentation of sarcoidosis here? What are we going to do for screening for that? We're going to get an FBE. We're going to get an ESR. We need to check the HLA status, rheumatoid factor. You would consider a chest X-ray, and I would have a relatively low threshold, particularly these days where the amount of radiation for a chest X-ray is very, very minimal. And so I think with that family history there and this recurrent presentation, I think it would be reasonable to do that as a screening process for sarcoidosis. And of course, tied into that as well, you'd be checking your ACE, your serum ACE levels. Again, one of those screens for sarcoidosis there. Now, I also want to point out here that we have multiple potential correct answers. And in fact, we have more correct answers than we have options to choose from. And you will see this time and time again. Again, I want you to remember, they're trying to get you to pass this exam. They're trying to give you marks. It may not always be quite as many as this, but often there will be more correct answers than you have the ability to select. So if you're really kind of stuck between two, really kind of chewing up between those answers, sometimes remind yourself that it may actually be both of those are correct, and part of that response could be which one are you going to prioritise in that instance, and hopefully that lets you sleep at night knowing that you're probably on the right track, but you may have more potential answers there than you can select from. Does that make sense? Excellent. Good.